All right. Hello and welcome. I am Dr. Hailey Nelson. I am a pediatrician. I'm a mom of three beautiful children, and I am currently Dr. California America 2021. Loving the title and the sash and adding some sparkle to the advocacy work that I do. So I'm here today as your host for the Safe Kids Central California Lunch and Learn series. I've got my friend Carlos here. I'm going to let him introduce himself and his role at Valley Children's Hospital.
Hi, Dr. Haley. I don't have my sash, which is usually the ugly registered nurse from Valley Children's. But nonetheless, my name is Carlos. I am a registered nurse. I'm the trauma coordinator for Valley Children's Hospital Pediatric Trauma Center, which means I get to oversee the program that takes care of injured kids.
All right, so you see how kids get hurt, and we're here today to talk about how to keep your kids healthy, how to keep your kids safe. And our topic for today is actually vehicular heat stroke. So the weather's getting warmer. I'm sitting here in front of my beach picture. So we're talking about things are getting warmer in the Central Valley, and that includes your car.
Very much so. And so what we want to focus on is what can happen or what the dangers are with regards to leaving kids in parked cars, especially during the warmer months. Now, unfortunately, we have many stories every year about kids that, for one reason or another, are either trapped in a parked car or are intentionally left in parked cars, and tragically, they succumb to heat stroke. And one of the first things that we need to remember is that we have about 40 to 50 of these kids that tragically die every year because of this. Now, what is heat stroke? So essentially, it's when the core body temperature reaches 107 degrees or higher. That is a very, very high core body temperature that can lead to some very severe consequences. Oftentimes, the symptoms will include things such as nausea and vomiting, maybe getting a little confused, having muscle aches or muscle cramps, and then all of that can lead on into more severe symptoms such as seizures, irregular heart rates, and then finally the body shutting down. So those things can, of course, occur outside of what we're talking about the, not being trapped in cars, but can also happen while being out in the heat. So it's critically important that we monitor that and keep ourselves cool during the heat.
Yeah, definitely. And this is getting that body temperature higher than what a fever is. So when we talk about a
Correct.
fever for a child being 100.4 or higher, when your child is in a locked car, so if you've got your car and the kid happens to be in the back seat and you leave them there, whether it's by accident, you're just running to the store, like there's reasons why kids end up in cars, but that especially as it gets warmer out, that it actually just turns your car into an oven. It really starts to get hot. So tell us, what's the number? So if it is, 90 degrees, like give me a number for temperature outside versus temperature inside that car.
Well, every 10 minutes, the inside of a parked car, for example, that's sitting out in the sun, the internal temperature will rise by 20 degrees. So we can have a car that's out in the parking lot that is easily 40 to 50 degrees higher than the ambient temperature outside. And in fact, we do have cases where it was considerably higher, almost 100 degrees, 80 to 100 degrees hotter on the inside of the car. And I think we'll show you a picture of that in a second. But what happens is, I saw you had your cute little pink car. Oh, well, here's a picture of here's a picture of a demonstration that we do on occasion. And what you're seeing there is, this is a very hot car because of how it looks. It is a hot car, but literally is a hot car because of the temperature that is on the outside. The ambient temperature of the air outside of the car is 98.3 degrees, the lower number that you're seeing on your screen. The inside of the car, believe it or not, reached 180 degrees, considerably higher than the 40 to 60 degrees that I mentioned earlier. So that really is not compatible with being able to be alive, quite frankly. And as you know, our lowest temperatures on ovens, for example, is like 175 degrees or something to that effect. But a child can easily succumb to this type of heat.
Yeah, that's dangerous. Now, there's a mnemonics, there's tips for how to help parents. So remembering that your child is in the back. I've heard about putting your purse in the back seat next to your child's
Hmm.
car seat so that you have to, when you're getting out of the car to go, that you've got that check. Because I think at some point as parents, you kind of can hit autopilot. And so
Hmm.
not even like stopping to remember, or if your routine's a little bit different. So that's one that I've heard. What other tips do you have for parents so that they can make sure that their child doesn't get left in a car this summer?
Yeah, and so those are very tragic situations that you were just talking about, because it is, of course, not intentional that this happens to some of these kids, where usually what you have is a change in routine, where perhaps mom is the one that usually takes the kids to daycare, and then there's a change in routine where the spouse or the child's father has to pick up that routine and is not normally doing that. That also happens in the opposite direction as well, the mom and between the mom and the dad. But nonetheless, it's usually a change of routine. We get into our automatic routine of driving to work and thinking in terms of what we're going to do next when we have to get to work. Perhaps it's a stressful situation that we're having to anticipate. And quite frankly, the child falls asleep in their car seat in the back seat, and the parent forgets that the child is there. I know that for a lot of us, it seems like it's something pretty unusual, and it is, but it can happen, unfortunately. And then arriving to the place of work, and then running off and to get to work, and the child is left alone in the back seat. Other scenarios happen where a child is outside playing around cars, and they have a natural curiosity, and they find their way into an unlocked car and then become trapped in that way. And then, unfortunately, you do have the other scenarios where kids are intentionally left in vehicles for one reason or another, and then they succumb to the heat. So you mentioned the acronym. Yeah, we do have an acronym, ACT, A-C-T, ACT. The A stands for avoid. So avoid those situations completely. Never, ever leave a child in a vehicle intentionally because of the reasons that we had just mentioned. It only takes 10 minutes for 20 degrees to increase. The child is very susceptible to hyperthermia. That's the increase in core body temperature. And even more so than adults. In fact, their body temperature rises 4 to 5 times more quickly than it does in adults. And also, they're very susceptible to dehydration, which also lends a hand into this type of problem. Okay, so avoid, never ever leave a child or an elderly person, for that matter, in a parked vehicle. The C stands for create. C for create. That means create reminders of things that, like you had just mentioned, especially if we're out of routine. Put a briefcase or a purse or your backpack next to the child in the car seat, or even your cell phone. Take your cell phone out and put it in the back seat, because we shouldn't be using our cell phone anyway while we're driving. But nonetheless, some sort of reminder that will make you or force you to look into that back seat when you get to your destination. And then T stands for take action. T, take action. That means, and people have gotten really, really good at this since we've had this awareness campaign for a few years. But if you see a child left in a car in a parking lot, don't just ignore it. Take action. And depending on the state of that child will determine to what extreme we have to take action. I personally have been involved with this, and it can literally save a child's life. Normally, what we recommend is that taking action means calling 911 and letting our 911 dispatcher know what the scenario is, and they'll usually get somebody out there immediately. Also, if you're in a parking lot, for example, of a shopping store or any kind of a store or business, notify the security agent that's out there, and make sure that if the child is not responding to you with banging on the window, is obviously obtunded, At that point, we may need to rescue the child even before first responders get there. If we do find a child and rescue a child, or we do suspect that hyperthermia has taken over a child, do the obvious things. Get that child or person to a cool area and begin cooling them off. You may need to disrobe them, and then also providing cool water, not ice cold water, but cool water on their body so that it can begin evaporating and take some of that heat away. Preferably do this inside of an air-conditioned building, but if you're in the outside, go into the shade or something to that effect.
Okay. Wow, great tips. Thank you for covering that mnemonic. I think it's really important that we're talking about this today. Again, I love living here in Fresno. We have 300 days of sunshine, which is a selling fact for being a former Seattleite. Fresno is my home and it's wonderful,
Right.
but it gets warm here. So really, we want parents to be thinking about this. So we're going to pull up the recap slide so we can go over that mnemonic one more time to drive our points home and really be able to reinforce kind of what we are here talking to you, Carlos, about. So thank you so much for sharing that information. All right, friends. So we're going to remember to act, which means one, avoid heat stroke by just not leaving your child in the car. And I know it can be hard, especially if they fall asleep and you just need to grab something. And it's such a pain to wake up a sleeping child sometimes or whatever that situation is. But we're just going to avoid that as it is getting warmer, that your child never stays in the car. We're going to create those reminders so that if you turn into autopilot, that it just doesn't happen because you've got to grab your purse, your phone, whatever it is that's going to remind you to also check that car seat and make sure that everyone is out of the car. And then, of course, we're going to take action. So if you ever see someone who is locked inside a vehicle and it is warm outside and there is no one coming to their rescue, be the one, be the rescue, call 911, notify security, like get them help because you really could save a child's life. So those cars get hot very fast. Preventing this at home means really keeping your keys up. We don't want kids playing in cars. So the accidental situations that can happen just by if your child's out playing car tag, thinks it's a really good hiding spot and then gets locked in the car, that's not something that you want to have happen at your house either. So cars are for travel, they are not for play. And that if you are looking for your child, we're going to be having another water safety episode soon. So we'll be talking about if your child's missing and there's a pool, look there first. But another place to look is your car. So keeping that in mind this summer, if you are in fact looking for your child, that's a place that you should check because that's a place where they can get into danger quickly. And then keeping those reminders. So thank you everyone so much for joining us today with Safe Kids Central California. Please like and follow our Facebook page. We've got lots of content that we continue to post. We have multiple episodes planned coming up, but if there is anything that you would like to hear from us, I'm here ready to listen. So please send us a message and we look forward to seeing you next time. Thanks again for joining us today. Have a great day.
Thanks. Bye, everybody.